We finally made it here. We arrived after really long travel. Myself personally, I started in Frankfurt, but some other colleagues actually started in London and in France, so they traveled even further. And then from Frankfurt we flew to Addis Ababa in Ethiopia, where we had a short layover. From there we flew with the United Nations Humanitarian Air Service, special transport for the crisis, to Accra in Ghana, where we stayed the night in a special quarantine hotel. Then went back to the airport and flew again with a special flight of the UN to Yaoundé in Cameroon. And of course, at all the airports we had to pass special health screenings. So our temperature was taken, we had to answer if we had any symptoms of COVID. But luckily all of the team members passed all of these tests. And so finally we arrived and we're looking forward to a successful mission. Just now we had the chance of meeting an expert in the field of infection prevention and control to hear what his experience has been in the country during the COVID-19 crisis, but also to learn a little bit of the activities that they have done so far and to hear where they think that there is more need for assistance, so that we can coordinate the activities of Malteser International also with the activities of the World Health Organization in order to ensure that we are working complementary. So we had the opportunity today to do our first assessment, and we were invited and welcomed by the director of the hospital, which was very kind to us and opened the doors of the hospital to us. So we first started with a tour around the hospital, where we basically followed the steps that a patient who's arriving at the hospital will take, so the so-called patient flow. And then we also had an opportunity to take a look at the special triage station and the special ward that were set up here to manage COVID patients and to be able to treat them safely, to be able to protect the staff, but also to provide the appropriate treatment for the patients. Our visit so far has been very interesting, but we're not done yet, and we hope that we will come back tomorrow to see more and also to speak with the doctors and the nurses here to see how they're working. But what we've seen so far is very impressive, and actually I am really impressed to see what they've set up here in the central hospital. It's quite impressive.